Hi, my name is Lena, and I'm going to be explaining the barium enema. First, I'm going to show you all the supplies. Here's the bag that the barium will be entered and filled with, I guess. And then here's the tip that will be inserted into the patient. And here's the bag to cuff it in. And we'll blow it up just like that. I'm just showing you guys how it is. Okay, so once I have the patient lying on the table, I'm going to lube this up with sterile lubrication. And I'm going to gently slide it in. And then once I feel a certain point, I'm going to hook it to the left and up. And that'll be up into the rectum. And once that is, I'll wait for the radiologist to either have me and blow it up or he will. And then once that's inserted, the patient will be moved in many different positions, and that's it. Okay, hi, my name is Lena, and this is Viviana, and right now I'm just going to double check her ID and everything. So give me your full name and date of birth for me, please.
Viviana Cuevas, 10/31/83.
Perfect. Is there any chance that you could be pregnant?
No.
No. Okay, I know we kind of explained the procedure to you, but I want to go over it again. We're going to be laying you on the table and inserting something through your rectum, and we're going to be filling it with barium, so it's going to be slightly uncomfortable. After that's done, the radiologist will come in and we're going to roll you in a few different positions, so it's going to be uncomfortable, but we're going to try to do it as fast as possible so we can get you out of here, because we know that you don't want to be here. So the first image, I'm going to have you lay down on the table. The first image we do is a scout image of them, and we want to just do this to make sure that our patient was a good patient and is a cleaned out stomach. So we're going to detent the tube first and line everything up, and line the bucky up here. It's on a 14/17, and we're going to use center at the crest, and so that's that. So I'm going to develop this image, and then I'm going to go talk to the radiologist and show it to him, and then come back in here, and I'm going to have the patient roll onto her left side. And this is where I'm going to put her in the sense position, and I'm going to lubricate the tip and slightly enter it in, and after that, I'm going to have the patient roll back onto her back, slowly and carefully. And the first image we do here is the scout image, and it's going to be 30 degrees cephalic, and this is to show the sigmoid colon. So I'm going to make sure that everything's lined up, and this is on a 10/12, and you center at the as is. So I'm going to drop this down. I'm going to collimate in. And then I'm going to have to remember that through all these barium that the technique needs to be at least 90 to 100 kV. So we're going to shoot this x-ray, and then after that I'm going to have the patient roll onto her right side. Just like that, and I'm going to do a right lateral DQ. And this central ray is going to be at the as is. And I'm just going to have the tube here and angle through it. We're just going to do it that way. Okay, so right now I have my patient Viviana in an RPO, and it's 30 to 35 degree angle for her body, and I'm going to be centering at the crest, and it's going to be 1 to 2 inches midline, and she's on an RPO, but we're going to be looking at her left splenic flexure. So once I've taken that image and lined everything up, I'm going to go process it, and then I'm going to have the patient roll flat to her back, and then roll into an LPO, which will be 30 to 35 degrees rotation as well. And I'm going to be centered at the crest and 1 to 2 inches midline. And then this is going to be taking images of her right colic flexure or right hepatic flexure. So once that's done, patient roll all the way up onto her left side. And I'm going to do a left lateral rectum image. It's perpendicular. It's on a 10 by 12, and that's it. 3 inches posterior. Just cut it. Okay, once we finish the lateral rectum image, I am going to take the barium and everything out. After the radiologist has seen all the images and know that he's good, I'm going to take the tip and everything out. So just take a deep breath in, Viviana, and relax, and we're going to release it out. And I have some towels here for you, so if there's any mess, I'm just going to hand you some towels, and you'll be able to cup yourself and go to the bathroom. Okay. So I'm slowly taking it out. Here's the towels, and I'm going to have my patient get up, and she's going to go to the bathroom, have everything clear out, and then when she comes back, I'm going to have her lying on her back. And we're going to do one last post-evac image, just to see that all the barium has been flushed out and cleared out. And I'm going to center, it's on a 14 by 17, I'm going to center on my crest again, and my Becchia. That's the barium. Thanks. The first image done is a scout image. It's on a 14 by 17, and this is to show that the patient's intestines are empty. The second image is an AP upshot. It's 30 to 40 degrees cephalic and 2 inches below the as is, and this is to view the sigmoid colon. The third is a right lateral D cube, which shows the descending colon and the medial side of the ascending. The fourth is an RPO, which shows the left splenic flexure. The fourth is an LPO, which shows the right hepatic flexure. And then we have a right lateral D cube into a left rectal D cube. And then we have the post-evac, which happens after we remove the enema bag and the patient goes and empties everything out.